Another study which was conducted in Britain, about 265 dildos put on market. They put on market big ones, medium, and small ones. And someone would say, oh, women picked the big ones because people think that women like big penis. That's not true. Actually, women picked small, medium dildos or sex toys to use. Why? What does this show? It shows that most women will actually need something within the average, 4.8 inches, 5.1 inches. These are the things that were taken, and the market was dry, and the big things stayed there, and very, very tiny ones stayed there. Why? Because people actually like. And what is the actual average long erect penis? What is the average? The average will be 5 for every man. So most men actually are fitting the size of most women. That's what we are saying. That most men are fitting the actual average that most women like. And what they realize is that for one night stand, a woman would prefer something huge and actually out of order. That someone would like that pressure, that intense sex, but they would not like it for continuous marriage exposure. Women do not like that if it is to be continuous every day. That's why a woman will be disgusted of your sex as long as you have a very huge and big penis which doesn't fit her properly. She would actually need something smaller and something medium if something is to keep on and on. If you're having to have sex in the morning, sex at lunchtime, in the evening, a woman would never like something very huge and very big. So they will keep you around. If you have something very big, they keep you around for benefit, maybe 1 time, 2 times, maybe in a month once, but they wouldn't like to have you every day. So that's what we are saying, that women actually, most of them like the average penis as of in an erect man. As long as you're small, as long as you're big, what actually matters are those 4 factors. 1, your size. 2, her size, the techniques, and the anatomy. Know the techniques we have taught you in the video. We are going to pin it in the comment section. Make sure that you get to know these techniques that you can use to make every woman get orgasm, or every woman bow down for you, so that you can have the best out of it. See you in our next video. So having seen the different types of vaginas that most women have, according to how you look at them, when you look at their eyes, when you look at their face, when you look at their fingers, you could actually tell, according to ancient theories, how deep, how big, how wide their vaginas are. So now today we want to know which size actually works for them, which size is needed for them to get the actual satisfaction that is actually need. So according to some ancient studies, in around 1920s, in 1920s, a certain French princess who actually never used to get orgasm when it is vaginal. If it used to be vaginal penetration, she would not get orgasm. So she actually got confused, and she was paralyzed, and she was perplexed, and then she would be there and be like, wow, why is it that every time I get sex, I don't get orgasm? As long as it's vaginal. And if it is not vaginal, I can get orgasm. So she actually collected very many women, above 1,000, and she started measuring the distance between the clitoris and the vaginal canal in every woman. And what were the hypotheses? What came out is that the longer the distance from the clitoris up to the vaginal opening, the less likely is someone going to get the orgasm from vaginal penetration. Simply meaning that as long as your vaginal canal is far away from the clitoris, then your orgasm, or the way you're going to get orgasm, will be less likely to consider the penetration. It would actually need someone to be a good stimulator, or to stimulate properly your clitoris for someone to get orgasm. So someone who is having this distance, which size do they need? Whether short, whether long, they do not need something to penetrate so far with them, because they want to get the actual satisfaction they need. So if someone is having this, also that factor matters.